Uh, Hello, guys. Good morning, good afternoon, or good evening to all of you, wherever you are. I'm Dr. Dante Roel Fernandez. I'm a part of the Anatomy Working Group. My topic for today is all about the mediastinum. So let's start. My second slide is all about the learning outcome. So for the topic for today, these are my learning outcomes. Describe and identify the gross anatomy of the mediastinum. Describe and identify the major branches of the thoracic and abdominal aorta. Describe and identify the tributaries of the superior vena cava and inferior vena cava. And then last but not the least, describe the gross anatomical organization of the lymphatic system. Before I continue, guys, I want you to take note two things. Number one, I highlighted number 2 and 3, learning outcomes number 2 and learning outcomes number 3, primarily because I have produced another video pertaining to these two learning outcomes. So for today, I will not discuss 2 and 3, but I will be concentrating on learning outcomes number 1 and learning outcome number 4. For my next video, I will discuss learning outcome number 2 and learning outcome number 3. Another thing that I want you to take note, guys, is the use of the term branches and tributaries here in the learning outcomes. What do I mean by this? Please take note that if you are talking of any description towards the artery, particularly on the different arteries of the body, please use the term branches. Example, if you're talking of branches of the femoral artery, branches of the popliteal artery, or branches of the brachial artery, that is the appropriate term to use, which is called branches. For the vena cava, or for the veins per se, the appropriate term to use is tributaries. Tributaries are specifically for what we call veins. No? You would learn in other sessions that there is a big difference between arteries and veins. That's why we have also specific terms that you should use when you are describing an artery and a vein. So please take note, guys. Branches are for arteries, tributaries are for veins. Okay? So the next topic is all about the links to the case. So what does it mean? It simply means that let's look at the case and let's see what are in the case that can link our topic for today, which is all about the mediastinum. The mediastinum is important, guys, because like what I have already mentioned to you earlier, there are organs which are located in the different spaces of the mediastinum. Another thing is, look at one of the problem that Jack had. No, I hope you have read the case. No, the case is all about Jack and Paul Armstrong. They are brothers. Unfortunately, Jack died. Why? Because he had what we call an abdominal aneurysm. Please take note, in our topic for today, which is mediastinum, one of the organs that you need to study is the abdominal aorta. So what Jack had, which is abdominal aneurysm, which burst, is actually the topic that we will have today, no? Primarily, which is the abdominal aorta. Another thing to take note, guys, is when Jack died, Paul actually at the time, no, was sad, and he was curious of what? Curious that can he have also the disease that Jack had? Can he also die of abdominal aneurysm? So the doctor actually explained to Paul that yes, there is a link between the heart attack and the aneurysm. Why? Because right now, Paul is not in a tip-top shape. We can say that, no? Why? Because when we did the physical exam, he was weighing 78 kilograms. He was about 180 centimeter tall, and his blood pressure is 162/92, which is high. So the doctor explained everything to Paul, and at the same time gave him an advice that he has to start doing some changes, no, in his life so that we can prevent, or he can prevent, what we call an abdominal aneurysm, because he is actually high risk. So what the doctor advised to Paul is, number one, to do more exercises. Number two is to lessen his weight. And last but not the least, number three is to control his blood pressure. So the following were given to Paul, like for example, the lisinopril, the atorvastatin, and the losartan. For now, I will not discuss different medications because it's quite complicated to you. All I'm trying to say is, if you try to read lisinopril, atorvastatin, and losartan, these are actually medications that decreases the blood pressure and at the same time decreases the cholesterol in the blood. Okay? So let's talk about mediastinum. No? So it's a broad median partition, no, located in the thoracic cavity. Okay? If you want to be very specific, it contains practically all the thoracic viscera except the lungs and the pleura. No? Again, I just want to point out, no? It contains all the thoracic viscera or thoracic organs except the lungs and the pleura. If you do not know what do we mean by pleura, guys, the one that covers the lungs is what we call pleura. So everything or all the organs that is located in the thoracic cavity except the lungs and the one that covers the lungs is actually in the mediastinum. Okay? So aside from that, what do we need to take note? What we need to take note, guys, is the boundaries of the mediastinum. Why do we need to take note the boundaries? Because we are in anatomy, no? Boundaries are very important to us. And at the same time, please take note, guys, that the mediastinum, look at the figure, no? The upper part of the PowerPoint. You can see a figure wherein it says superior mediastinum, and then it states that anterior mediastinum, middle mediastinum, and posterior mediastinum. I want to break this further, no? As you can see, in the superior mediastinum, there is what we call a line. Can you see that imaginary line that divides the superior mediastinum from the rest of the mediastinum? Primarily, this superior mediastinum, no, is located superiorly, while the one that is below the imaginary line is what we call an inferior mediastinum. This inferior mediastinum is further divided into what we call anterior mediastinum, middle mediastinum, and posterior mediastinum. Actually, if you want to be correct anatomically, we can say that it is anterior inferior mediastinum, middle inferior mediastinum, and posterior inferior mediastinum, because this anterior, this middle, and this posterior mediastinum all belongs to the inferior part of the mediastinum. As you can see, mediastinum is a big, broad, no, partition, literally divided into superior and then inferior. You can look at the figure and see there is an imaginary line, no, bisecting the mediastinum into superior and inferior. So let's look at the boundaries. No? Why do we need to look into the boundaries? Because the boundaries are the one that limits the spaces. No? And then we have to take note the different boundaries, primarily because we are in anatomy. What do I mean by this? We need to take note the anterior boundary, no, of the mediastinum as a whole. No? So as a whole, anteriorly, what is the boundary? All the bones in front, which is actually your sternum, or sometimes we call it the breastbone. No? So that is the anterior boundary. No? And then at the top, no, the superior boundary, no, superior boundary is actually the thoracic inlet, no. You can see the thoracic inlet above, no? Thoracic inlet, that is the superior boundary of the whole mediastinum. And then below, you can see the inferior boundary, which is the diaphragm. And then the anterior is the sternum. No? Anteriorly, you can see there are bones. No? And then we have the posterior. That is what we call your vertebra, your T5 until T12. Those are thoracic vertebra, which is the posterior boundary. Okay, and then the lateral boundary is your mediastinal pleura. No? As you can see, the mediastinum is located in the middle, no? Middle of the thoracic cavity. No? At the lateral portion of that mediastinum, that is the one that limits it laterally, which is what we call your mediastinal pleura. If you do not know, pleura is a covering of the lungs. Okay, so the one that covers the lungs medially is also actually the lateral border of the mediastinum. So look at the figure, guys. No? I hope you can see number 1, 2, 3, and 4. So this 1, 2, 3, and 4, these are all mediastinum. Let's try to look at the red line, the line that is dividing the number 1 from the rest, which is the 2, 3, and 4. So the red line, anything that is above the red line, that is what we call the superior mediastinum. Anything that is below the red line, that is the inferior mediastinum. So for the inferior mediastinum, please look at it, because it is further divided into number 2, number 3, and number 4. Those compartments, which is actually subdivisions of the inferior mediastinum, is number 2 is the anterior mediastinum, number 3, that is the middle mediastinum, while number 4, that is the posterior mediastinum. Okay, actually, if you want it to be if you want it to be anatomically correct, no? Using the terminologies, it should be anterior inferior. Now, why is it anterior inferior? Primarily because it is located anteriorly and inferior of the mediastinum. So middle inferior, and last but not the least, posterior inferior. No? Why? Because it is located posteriorly. And why inferior? Because it is part of the inferior mediastinum. So let's try to study the number 1 first, no? Which is the superior mediastinum. Let's study the boundaries of the superior mediastinum. So where is superior mediastinum? That is number 1. So that is superior mediastinum. So let's look at the boundaries of your superior mediastinum. So superiorly, the primary boundary is the thoracic inlet. That is actually the communication of the mediastinum to the environment. That is the entrance, or that is the opening of your superior mediastinum, the superior or thoracic inlet. What is the inferior boundary? The inferior boundary is the imaginary line that is dividing the superior from the inferior mediastinum. So that imaginary line, please take note, starts from the sternum, which is specific part of the sternum that is called the manubrioesternal joint. Manubrioesternal joint, or sometimes called the sternal angle of Louis. That line goes at the back until where it is at the lower border of the 4th thoracic vertebra. So that is the imaginary line. That is the boundary or the inferior boundary of the superior mediastinum. Okay? And then we have the anterior boundary. The anterior boundary is the manubrium sterni. What is manubrium sterni? That is actually a part of the sternum. No? So, anterior boundary of the superior mediastinum is the manubrium sterni. And then posterior, what is the boundary? These are the upper thoracic vertebra, the 4, the 3rd, the 2, and the 1. These are all posterior border of our superior mediastinum. And then last but not the least is the lateral boundary, which you will not be able to see here. But please take note that the lateral boundary of the superior mediastinum are the mediastinal pleura. Now, please take note that pleura means covering of the lungs. No? Pleura is a covering of the lungs. So the lateral boundary of the superior mediastinum is the mediastinal pleura. So next, no, what do we need to take note? We need to take note the contents of the superior mediastinum. Again, look at the figure. What are the contents in the number 1? No? Figure number 1, or the figure which is above, which is number 1. What are the contents there? What are the organs in that number 1? So let's identify. No? So the first content is the thymus gland. No? As you can see, thymus gland is a bilobe. It is located anterior, no? in the thoracic cavity. It is anterior to your arch of aorta. It is anterior superior to your heart. No? You can see that the thymus gland is there. It's a primary lymphoid organ if you do not know. No? The primary function is to process, no, T lymphocytes, a very important part of our immune system. That is your thymus gland. The next is the arch of aorta. You are not able to appreciate the arch of aorta here, but I have in the next video, you would be able to see, no, the arch of the aorta and its branches. No? But just to give you some information, so the arch of aorta is located superior to your heart. No? It has 3 important branches. The one on the right is your brachiocephalic trunk. And then one goes up on the left side, which is your left common carotid. And then another one goes to your left. That is called your left subclavian. So those are the 3 important branches of the arch of aorta. Again, just to repeat, we call it brachiocephalic trunk, left common carotid, and then left subclavian artery. Don't worry, in my next video, you would be able to appreciate what you would be able to identify the arch of aorta and its branches. Okay? So the next is the superior vena cava. Why am I highlighting it like this? I'm highlighting the superior vena cava primarily because it is part of the learning outcome. Okay? What do I mean by that? You need to be able to describe and identify the different tributaries of the superior vena cava. I have prepared a video particularly for this, but I just want to give you some important information regarding superior vena cava. No? So this is the superior vena cava. It drains the upper half of the body. What do you mean by drains? Drains takes the blood from the superior or from the upper part of our body. No? It is formed by your 2 innominate veins. No? Your right and your left brachiocephalic veins. No? So that is the one that makes up your superior vena cava. Please take note, the superior vena cava is a valveless vein. It is about 7 centimeters in length. It receives the azygous vein posteriorly. I will try to identify and describe azygous vein in my next video, particularly talking about the superior and the inferior vena cava tributaries. And then we have the azygous vein. You are not able to see here the azygous vein. So like azygous vein, like what I mentioned to you, is a tributary of the superior vena cava. It is going towards the superior vena cava at the posterior part. And then we have the phrenic nerve here. You have the phrenic nerve. You can see we have one on the right. We have one on the left. They will actually go and innervate the diaphragm. So it means they are the motor innervation of the diaphragm, the phrenic nerve, which comes from C3 and C4. And then we have the pericardiophrenix vessels here. Red is the artery, the blue is the veins. That's why they are called pericardiophrenik vessels because they are arteries and veins. They accompany the phrenic nerve. Okay, so we have here the vagus nerve. Vagus is cranial nerve 10. Very important also, but no need to expound on this because the vagus nerve, you will have a different topic for this. And then we have the thoracic duct, which you will not be able to see. Yes, you will be able to see here the thoracic duct. Thoracic duct is located in between the internal jugular and the subclavian vein. Later, during my lymphatic topic, I would be able to show it to you. The right lymphatic duct and the thoracic duct. And then we have the trachea. Here you can see the trachea, or otherwise known as windpipe. No? What does it do? It provides air from the upper part of the respiratory going towards the lungs. No? It facilitates the passage of air, trachea. And then we have the esophagus. Last but not the least, it is located at the back of the trachea, which you will not be able to see here. It is part of the digestive tract, no? Esophagus. So these are all the contents of the superior vena cava, the number 1 in the figure. So all of this from number 1 until number 10, they are all located in the superior vena cava. So we're done with the superior mediastinum. Let's talk about the anterior mediastinum, the middle mediastinum, and the posterior mediastinum. Actually, for here, guys, I will not be able to talk about the middle mediastinum because the middle mediastinum per se is a different topic. Middle mediastinum is actually the heart. So what I'm going to talk about here is only the anterior mediastinum and the posterior mediastinum. To be very exact, the anterior mediastinum is the number 2 here in the figure. So that is what I'm going to talk about, the anterior mediastinum there. That's the anterior mediastinum. So let's talk about the boundaries of the anterior mediastinum. What is anterior to that? What is superior, the inferior, the posterior? Okay? So let's continue. For the superior, the imaginary line. That is the superior boundary of the anterior mediastinum, the superior imaginary line. Again, guys, let's just go back. The imaginary line starts from where up to where? It starts from the manubriosternal joint, or otherwise known as sternal angle of Louis, until where? Until the lower border of the thoracic vertebra 4. Okay? So inferior boundary, that would be the diaphragm, and then anterior boundary, that would be body of the sternum. Like what I told you, the sternum is the breastbone. It is divided into different parts. Manubrium sterni, body of the sternum, and then xiphoid process. So the anterior boundary of the anterior mediastinum is actually the body of the sternum. And then the posterior boundary is actually the anterior surface of the pericardium, the heart. No? Pericardium is a covering of the heart. So anteriorly, that is the posterior boundary of the anterior mediastinum. So next, guys, what we will talk about after learning the boundaries of the anterior mediastinum is talk about the contents. No? So I think this one is very easy because we only have 2 contents in the anterior mediastinum, which unfortunately you will not be able to see in this figure, no? But I will explain further. So the contents, number 1, number 2, the number 1 is the superior and inferior sternopericardial ligaments. And then number 2 is lower part of the remnant of the thymus gland. Here, the lower part of the thymus gland you are able to see. No? Lower part of the thymus gland, that is part of the content of the anterior mediastinum. For the superior and inferior sternopericardial ligaments, no, the ligaments that connects the heart into the body of the sternum, that is called the superior and the inferior sternopericardial ligaments. No? So it suspends the heart or the pericardium in the middle of the lungs. So the ligaments that connects the pericardium into the sternum or body of the sternum is the content of your anterior pericardium. So next, look at the figure again. No? So we're done with number 1, which is your superior mediastinum. We're done with number 2, which is your anterior inferior mediastinum. We will not be talking about number 3 because it's another topic. So let's go to number 4, which is your posterior inferior mediastinum. So that is the posterior mediastinum. So what we will do is we try to look into the boundaries because we are studying anatomy. So boundaries, so superior boundary, that is the imaginary line passing from the upper border of the pericardium to the lower border of the T4, or this between T4 and T5. So as you can see, for the anterior mediastinum and posterior mediastinum, they have the same superior border, which is your imaginary line. Same with anterior mediastinum. They have the same inferior border, which is your diaphragm. So easy to memorize. The superior and the inferior boundaries of the anterior, inferior, and posterior inferior mediastinum are the same. Superior, imaginary line, inferior, diaphragm. So the anterior boundary is the posterior surface of the pericardium or the heart. So at the back of the heart, that is actually the anterior border of the posterior mediastinum. And then last but not the least, what is the posterior boundary? These are your vertebral bodies or vertebral column, which is your T5 until T12. Okay? So those are the boundaries of the posterior mediastinum. So contents of the posterior mediastinum. What are the contents? So what we need to take note are the structures inside number 4 in the figure. So contents is the thoracic aorta. Again, this is part of your learning outcome. Branches of the abdominal and thoracic aorta. So later, if you have time, I have another video that I have done specifically for learning outcomes number 2 and number 3. So that is the thoracic aorta. You can see there. This is the arch of aorta. I hope you can see the arch of aorta here. Anterior to your trachea, anterior to your esophagus, that is the arch of aorta. As the arches goes towards the left, it descends. Now you call it descending aorta or the thoracic aorta. Look at the arch of aorta. It has 3 branches. On the right, that is your brachiocephalic trunk. And then immediately on the left side, that is your left common carotid. And the far left, the one that is towards the left, to the left side is called your left subclavian artery. So those are the branches of the arch of aorta. So azygous venous system, again, you will not be able to see here. Later during my next video, I hope you will be able to appreciate these azygous veins. And then esophagus is there. And you can see also the esophagus. And then we have the thoracic duct. Again, you will not be able to see here. The sympathetic trunk and the thoracic splanchnic nerves. These are contents of the posterior mediastinum, which you will not be able to see here in this figure. So next, let's talk about the lymphatic system. For the lymphatic system, generally speaking, the primary function is to absorb the excess fluid in the different tissues of the body. Sometimes, when the circulatory system is not able to control the flow of fluid from intravascular to extravascular, some fluid goes out of the intravascular system or from the blood vessels per se. So this excess fluid, the one taking care of it to be put back into the blood system or into the intravascular system is the lymphatic system. So for the lymphatic system, it is composed of your lymph capillaries, your lymphatic vessel, lymphatic duct, lymph node, and the lymphatic organs like what? The spleen, the thymus, and the tonsil. So for the lymphatic system, these are the two main trunks, the thoracic duct and the right lymphatic duct. So what do these two important trunks does? Like what I mentioned earlier about the lymphatic system collects the excess fluid located in the different spaces of the body. So if you have excess fluid, it can actually cause edema, like for example in your lower extremities, no, in your feet. If you have excess fluid there into the tissue spaces or into the spaces in your lower extremities, it will cause edema or swelling, no? So for you not to have this, the lymphatic system will try to absorb the excess fluid. It will flow through your capillaries, your vessels, and then into what we call your thoracic duct and your right lymphatic duct. So these two main trunks will actually enter, no, the venous system. Look at the arrow. Look at the figure and you will see an arrow. On that arrow, there is a right and there is a left. On the right side, that is the right lymphatic duct. So the right lymphatic duct enters the venous system between the internal jugular and the subclavian vein. The right internal jugular and the right subclavian vein. While on the other side, the opposite side, the thoracic duct, it will enter the left internal jugular and left subclavian vein. As you can see, no, there is a small structure there, no, at the tip of the arrow. That is the thoracic duct entering the left subclavian vein and left internal jugular vein. On the other side, right lymphatic duct enters the venous system in between the right internal jugular and the right subclavian vein. So what do we mean by this? It simply means that the excess fluid into the different tissues or spaces in the body are still being brought back into the venous system so that this excess fluid will not be in the spaces that can actually cause what we call swelling. So as you can see, the excess fluid in the different compartments or different spaces of the body, which actually also came out from the intravascular system or the blood, will also be brought back into the blood. No, they came out of the blood vessel. They will also be put back into the blood vessel. So that is how it works. Look at the figure on the far left side of the PowerPoint. You can see in the picture the right side of the face, the right side of the chest, the right side of the abdomen, and the right upper extremities. It is being drained by your right lymphatic duct. While the rest of the body, the lower extremities, the left side of the abdomen, the left side of the chest, the left side of the face, the left upper extremities are all being drained by your thoracic duct. So the lymph vessels, similar to the veins, no? So they have also valves. So what do they do? Like what I've been mentioning to you, they will try to put back, they will try to absorb, they will try to flow the water or the excess fluid from the different lymphatic vessel into the two main trunks, which is your thoracic duct and your right lymphatic duct. So here, we have the lymph fluid in the lymphatic vessel, no? So what are we trying to do here? We're trying to take note what is the composition of the lymphatic fluid. So the composition is similar to that of the plasma. If you're not familiar, guys, the blood is composed of two major parts, the formed element and the plasma. The plasma is actually the fluid content of the blood. Okay, so the lymph or the fluid in the lymphatic system is almost the same with the plasma or the fluid part of the blood, or the blood that is inside the blood vessel. So as you can see, you can actually understand that this blood contains plasma or fluid part of the blood. Sometimes when they go out, they leak out, no? They go into the spaces out of the blood vessel. So what will happen? They will actually cause swelling or edema. So what this lymphatic system do is they will be absorbed and then brought back, or they will be absorbed and flow right into the two main trunks, which is your right lymphatic duct and your thoracic duct. So other than that, what are the contents of the fluid in the lymphatic vessel? We have the lymphocytes, and then normally the excess fluid in the small intestine after a meal, that is actually also being absorbed by the lymphatic system. So that is what is happening. Clear liquid, but the lymph from the small intestine becomes milky after meal, primarily because when you absorb it, the excess fat will actually be absorbed into the lymphatic system. So what composes the lymphatic capillaries? So they are the smallest conducting vessel of the lymphatic system. So they are the one that will try to absorb the fluid into the different spaces of the body. This lymph capillaries is actually connected on the lymphatic vessel. So they will flow from the lymphatic capillaries into the lymphatic vessel. And please take note, there is no lymphatic capillaries in the CNS, in the bones, and in the teeth. Then we have here, the next is the spleen. So it's a lymphatic organ. So what does it do? Primarily, it is for the destruction of blood. I hope you know that every 120 days, the blood will actually die. So if they die, where will they go? They will go here into the spleen. So it's an immunologic phenomenon. So it stores blood. It is actually filtering also blood. So all I'm trying to say, the spleen will try to get, or will at least try to process the dead cells or the dead blood cells in the body. So the next organ are the tonsil. So we have here your pharyngeal tonsil, your palatine tonsil, and your lingual tonsil. So primarily, what do they do? This tonsil actually tries to control the infection in the oral cavity. So for example, you have infection, they will try to limit so that that infection will not go into the different parts of your body. So primarily, that is the function of your tonsil. For example, you have an upper respiratory tract infection. So this tonsil will try to prevent the bacteria from your lungs to go and infect other organs of the body. So they will try to trap the infection here in the tonsils. They are part of the immune system. So thymus gland, I think I've already mentioned to you the thymus gland. So anyway, the thymus gland is a bilobe. It is located superior anterior to your heart, anterior to your arch of aorta. It is almost located in the middle of the thoracic cavity. It's a bilobe. The primary function is to process your T cells, T lymphocytes, very important in the immune system. They are very active when we are young, but more or less they become inactive as we grow old. So to summarize what we have talked about, so two important things that we have talked about: anatomy of the mediastinum, and then anatomical organization of the lymphatic system. For the anatomy of the mediastinum, guys, mediastinum is a pouch, is a space. It is located in the thoracic cavity. Please take note that all the visceral organs except the pleura and the lungs are in the mediastinum. There are two major parts of the mediastinum. We have the superior mediastinum, we have the inferior mediastinum. The superior and inferior mediastinum is divided by an imaginary line. It starts from the sternal angle of Louis, it ends at the lower border of the T4. Please take note, try to look into the boundaries of the superior mediastinum, the inferior mediastinum. For the inferior mediastinum, it is further divided into anterior, middle, and posterior. We did not talk about the middle. We only talk about the anterior and the posterior. So take note of the anterior of the borders. No? When we talk about the borders, we're talking of the anterior border, the posterior border, the superior border, the inferior border, and the lateral border. Another thing to remember, no? As we summarize, take note the contents of the different mediastinum. What are the contents of your superior mediastinum? What are the contents of your anterior mediastinum? What are the contents of your posterior inferior mediastinum? Okay? For the lymphatic system, like what I told you earlier, the lymphatic system, generally, what does it do? They try to absorb the excess fluid in the spaces in the body. So if we have this fluid in the spaces in the body, if they are not absorbed, they will cause what we call inflammation, swelling, or edema. So the lymphatic system will actually be the one to try to absorb the excess fluid in these spaces. Please take note that the lymphatic system is composed of your lymphatic capillaries, lymphatic vessel, and the two main trunks, which is your right lymphatic duct and your thoracic duct. So what will happen? Your capillaries will try to absorb, will try to flow the absorbed lymph or fluid into the lymphatic vessel, flow it into the right lymphatic duct and the thoracic duct. And please take note that the right lymphatic duct enters the venous system exactly at the right subclavian and the right internal jugular vein. While on the other side, the thoracic duct will enter the venous system right in between the left internal jugular and left subclavian vein. Okay? So what are the other things that we need to take note for the lymphatic system? We also need to take note the organs, no? In the lymphatic system. What are these organs? We have the tonsil, we have the thymus gland, and we have the spleen. No? For the tonsil, what do? They try to limit the spread of infection. For the spleen, what do? They try to absorb the dead blood cells in the body, while the thymus is the one that will try to process these T lymphocytes, which is very important to our immune system. Okay?